November is National Diabetes Awareness Month, and it's a great time to spotlight a condition that affects millions of people worldwide. It's actually one of the fastest growing health conditions in the world. I'm Kaleigh Knox, nurse practitioner with the Salina Regional Endocrinology Clinic.
November is Diabetes Awareness Month. Let's talk about why it's so important to bring awareness to diabetes.
There are millions of people in the world with this condition, and it's one of the fastest growing health conditions in the world. And a lot of people don't even know that they have it. So I think by helping to raise awareness, specifically in November, it helps people, or we can help people recognize symptoms a little bit sooner, which can then help them get screened sooner, which in turn can help us treat them sooner.
Let's talk about some of the misconceptions people have about diabetes.
Yeah, there are a lot of misconceptions between diabetes. So one of them that I hear a lot is that people who are overweight are the only people that get diabetes, or that diabetes is specifically caused by eating a poor diet or eating a lot of sugar, and that's really not true. There are a lot of things that go into the development of type 2 diabetes, or diabetes in general. Another misconception that I hear a lot is that type 1 and type 2 diabetes are the same, or that they're treated the same way, or that one is considered the bad diabetes. I've heard that before, and I think we can all agree that really neither of them are the good diabetes. So I always like to clarify, type 1 diabetes is an autoimmune disorder. Your islet cells are attacked by your body, and that's what creates insulin. So when your body doesn't have insulin, you have to get insulin some way. So people with type 1 diabetes have to take insulin as their treatment. Whereas people with type 2 diabetes, that means they're either insulin resistant or their body is just not making enough insulin. So a lot of times there are other options to treat other than just insulin, such as lifestyle changes or oral medications.
Let's talk about some of the key risk factors for type 2 diabetes and how people can reduce their risk.
Some of them you can't change. So some of them are things like genetics, family history, if you're over the age of 45, but then there are some things that you can change. If you live a very sedentary lifestyle, you're at higher risk. If you have a poor diet, you're at higher risk. And if you're overweight, losing just 5% of your body weight can help you lower your risk of developing diabetes. Adding 30 minutes of movement a day, making sure that you're eating a well-balanced diet, making sure that you're getting enough sleep, decreasing the amount of stress that you have on a daily basis if you can. All of those things can decrease your risk of developing diabetes.
Well, Kaleigh, thank you so much for coming on the show and for giving us some great information, and thank you for watching. For more information, please visit salinaregionalendocrinology.com.